Good morning and Assalamualaikum warahmatullahi wabarakatuh. I am Almar Salazar Angagaw, and for today's session, we're going to discuss, or I am going to discuss, the basic personality inventory. To formally begin with, we are lahat tayo, 'di ba? Naka-encounter tayo ng salitang or yung question na describe yourself, or how do you describe yourself? You describe yourself as an individual na matulungin, individual na mabait, individual na masipag, individual na something like always say yes on everything, no? And that is one traits, or isa sa mga traits natin bilang isang tao, and that what makes us human, no? And also, some people, no, kapag sinabihan silang describe yourself, they often tell na they can't describe themselves. They can't uh, basically describe who they are. They can't describe what they like, or what they want to pursue in the future. And that is one way of something like maladjustments, or something like you cannot identify your personal strengths and weaknesses. And that is why uh, we have a lot of tests with us, no, to evaluate or to assess a person's personality traits and characteristics. And don't you worry, because that is one of our parang dilemma na rin, no, kasi minsan hindi natin alam kung ano ba yung gusto natin, hindi pa natin alam kung ano yung personality na meron tayo. That is why we have tests, no, that is why we have such tests to evaluate or to identify the certain characteristics, or yung certain strengths and weaknesses na meron tayo bilang isang tao. So para ma-build na rin natin yung frame of orientation natin. Frame of orientation is which is alam natin kung ano yung gusto natin, alam natin kung ano yung gusto nating matupad sa buhay, yung mga pangarap natin, yung mga bagay na gusto nating i-pursue in the near future. So, moving on, no, uh, to the description of basic personality inventory. So, the basic personality inventory, also known as BPI, is a psychological assessment tool designed to evaluate a person's personality traits and characteristics. So, hindi lamang ito yung test na meron tayo, no. We have lots, or we have different bunches of tests sa psychology, which evaluates the person's personality traits and characteristics. And this was one of the efficient, no, for me, based on my research, because it is something like easy to follow, easy to do, and you're just going to answer it with true or false, or just going to put the check, no. And parang kind of survey lang siya. And it is an efficient way for me, because it is very convenient, it is very affordable, or it is very easy to us to answer, and doesn't bring any uncertainty dun sa isang tao. And that's what makes it more convenient for me. So, BPI, it is a form of psychological assessment, which evaluates a person's personality traits and characteristics. And it is also a way, or one of the efficient way of identifying maladjustments, or mga problema sa ating behaviors or sa ating personality, no, which is we cannot uh, something like we want to assess, or we want to know those maladjustments, or kung ano ba yung certain na dilemma na encounter natin sa ating personality. And it's also a good way, no, on the positive side, on the other hand, is it is also a good way on identifying our strengths and weaknesses, no. uh, because as an individual, no, we were striving for something like for the better, or we always wants to become better, no, not only for ourselves, but for the people around us. And with this test, no, which identifies the personal yung strengths and weaknesses natin, we can we can actually go beyond on what is being asked. So next is the basic personality inventory is ang proponent nito is si Jackson of 1996, is a 12 scale 2040 item true or false self-report measure of the general domain of psychopathology. So gaya ng sabi ko kanina, it is a test, no, it is a self-report. It is a self-report which consists of a 12 scale 2040 item. True or false lang siya, no? Yung gaya ng sabi ko kanina, gaya, that's why nasabi ko na convenient siya, or that's why na nasabi ko na very ano siya, like very convenient for an individual because it is only a true or false test. No, wala nang pasikot-sikot, wala nang something like magpuput pa ng uncertainty doon sa isang individual. And it is also it measures the general domain of psychopathology, kung ano ba yung nagiging cause ng mga mental illnesses or yung disorders na meron tayo, no? And it is also a very efficient in measuring those or in identifying those illnesses or disorders, in psychopathology. Next is development. The BPI was developed by Harrison G. Goh and Paul M. Bradley. It is based on the theoretical framework of the trait approach to personality. So, it was developed by these two philosophers or psychologists, no, and it is also based on theoretical framework. So, just like other tests or just like other theories, no, yung mga theories nila Sigmund Freud, yung mga sinauna pang mga proponent ng psychology, it is also based on a theory, no. Ang basis nitong BPI is also based on theoretical framework. Pag sinabi natin theoretical framework, it is the existing theories or yung mga previous theories na something like na publish ng mga philosophers or psychologists, which is doon natin minsan nakikita yung personality or something like nagiging basis ng personality ng isang individual. Okay, so next is structure. The BPI typically consists of a set of self-report items or statements that respondents rate based on their agreement or disagreement. So, gaya nung kanina, it consists of self-report items. So, it has nothing to worry about it, no, because yung mga statements or yung mga questions na kinokonsist nitong BPI, it was all about ourselves. It was all about ourself, no, because it is a self-report items or statements, and it is also ang gagawin lang ng respondents or ang gagawin lang ng yung mga ini-evaluate is to take or mag-check lang siya kung saan siya agree or disagree, no. So that's how basic we were doing this test, no. It assesses multiple personality dimensions, including emotional stability, extraversion, openness to experience, agreeableness, and conscientiousness. So, ayun nga, it assesses multiple personality dimensions, yung mga nabanggit ko, and kasi we all know that humans are very complex, no? Very complex siya, which is in some days or in some circumstance, we cannot understand. We cannot predict or we cannot said what is being shown to us. So it has to do with undergoing test. It has to do with undergoing this assessment, not to measure yung emotional stability, yung extraversion, yung openness to experience, agreeableness and conscientiousness, kung something like tumutugma ba siya or something like it has to do with the connections as a normal human being. Okay? So next is clinical application. The BPI is often used in clinical psychology to assess personality traits and gain insights into an individual's emotional and psychological functioning. So gaya nung nasabi ko kanina, BPI is often used in clinical psychology in the clinical field, no? Kung saan is it assess yung traits, yung personality ng isang individual, if aggressive ba siya, if something like something like hoarding ba siya or anything, no, yung mga personality o yung traits ng isang tao. And it is also to gain insights, no, para magkaroon na rin tayo ng idea or magkaroon tayo ng background knowledge about dun sa emotional stability or yung psychological functioning ng isang individual. Kasi mahirap ang isang test or mahirap isagawa ang isang test kung wala tayong any background knowledge or any insights or any information about a certain individual na nag-undergo ng test. So we need to gain insights first, and also for us to acknowledge yung emotional and psychological functioning ng isang individual. Next is research. Researchers may use the BPI in studies examining personality factors and their relationship with other variables. So uh, just like other tests, ang BPI is also a ginagamit din siya sa research, no? Ginagamit din siya sa research because gaya nung mga yung mga example natin, no, yung mga sa research instrument, yung mga survey natin, yung mga questionnaire, no, yung BPI is parang ganun din siya. Something like it has connections with that. And ang pinagkaiba lang is ang BPI is true or false siya, no? And researchers often use BPI in studies examining personality factors and their relationship with other variables. Well, we need to acknowledge also yung mga relationship or yung connection ng isang personality ng isang tao sa other variables, because as part of our experience, no, we were influenced by our environment, by our society, by our yung mundong kinagalawan natin, no. Gaya nga nung sabi nila that our behavior is a product of where we belong or where we grow as a person or as an individual. And it has been utilized in diverse areas including psychology, of course, psychiatry, and health research. Next one is validity and reliability. Like any psychological assessment tool, the BPI undergoes rigorous testing to ensure its validity and reliability. So, gaya ng ibang assessment tool or gaya ng ibang test na sinasagawa is that BPI also undergoes rigorous testing to ensure its validity and reliability. So, if an individual is still unworried or something like nako-conscious siya or na-anxious sa isang test, so in BPI, no need to worry because it undergoes a rigorous testing, not and also na ensure yung validity and reliability nitong test, which makes it a more parang flexible siya, no. We can use it in a more variety of field, in a more specified area of specialization, or in any field na kung saan is may connection or magmamatter siya, because it has undergoes rigorous testing and na-ensure yung validity and reliability nitong test na ito or nitong psychological assessment tool na ito. This involves assessing whether the instrument measure what it claims to measure consistently. So, it involves assessing whether yung instrument measures it, kung yung mini-measure ba is yung tugma ba siya sa kung ano yung dapat na i-measure ng isang psychologist, no, or ng isang professional. So, we're moving on in the important features of BPI. So, we have here, the BPI is a multi-scale inventory that assesses psychological problems. So, BPI is multi-scale inventory, no, and yun nga sabi ko, it consists of 240 items, no, kanina, and also it assesses psychological problems, no, yung mga maladjustments, and also it does not only focuses on the negative one, it also has to do with the positive, which identifies yung person's strengths and weaknesses. The inventory is appropriate for adults and adolescents and for both non-clinical and clinical populations. So, yung inventory or itong basic personality inventory is also appropriate siya for adults and adolescents. I don't know if I don't really I don't really think na applicable siya or advisable siya for children's kasi this test is only for the personality or assessing the personality or yung traits. And we all know that children's or yung mga bata is constantly growing or constantly nasa stage pa sila ng growth, which something like it has marami pang changes na pwedeng mangyari sa kanila, sa kanilang personality, sa kanilang traits, no? Pwede pa sila magbago. Okay? And both non-clinical and clinical populations, no? As I said earlier, because it was very convenient, it was very easy to use or easy to like does not contain so much complexity. So it can be used in non-clinical and clinical populations. So, ang BPI requires a grade 5 reading level and can be completed in approximately 30 to 40 minutes. Okay, so ang BPI, di ba? So, yun nga, sabi ko kanina, very convenient siya because it only requires a grade 5 reading level. No, and we are already like we undergoes educational backgrounds which makes us more educated, no? And it can be completed in approximately 30 to 40 minutes, no? Kasi nga 240 items siya, and also it has to be answered honestly, no? Honestly with confidence. So hindi mo siya pwedeng i-manipulate or hindi mo siya pwedeng i-falsify because it can bring something like inaccurate result dun sa personality or dun sa pag-uugali or dun sa traits na gusto mong i-measure sa sarili mo. The BPI's 20-item scale assesses hypochondriasis, depression, denial, interpersonal problems, alienation, persecutory ideas, anxiety, thinking disorder, impulse expression, social intervention, self-depreciation, and deviation. So, lahat ng mga nabanggit na yun yung pwedeng i-assess ng BPI, but it has not only limited on that, no? Those are some, but BPI basically assesses various dilemmas or various difficulties, no? Those are such important factors lang or yung mga important yung mga uh, yung very dominant na kayang i-assess ng BPI. Okay? So, we have your comprehensive assessment. So, isa sa important features or isa sa important features ng isang BPI is comprehensive assessment. The BPI assesses a wide range of personality dimensions. Gaya ng sabi ko kanina, it assesses a wide range of personality, no? Not only limited dun sa mga nabanggit, but it assesses wide range, no? Marami pa ang pwedeng i-assess ng BPI. Not only those na include, but it measures a wide range of personality dimensions or yung mga maladjustments, yung strengths and weaknesses ng isang individual. Providing a comprehensive view of an individual personality traits and characteristics. So, yun nga, yung result ng BPI is basically kapag nag-undergo ka nitong psychological assessment, it provides a comprehensive view, no? Kung saan is ma-measure or may evaluate natin yung individual's personality traits and characteristics. Next one is psychometric properties. So the BPI has been extensively validated and has strong psychometric properties. Gaya nung sabi ko kanina, you can use BPI in any field or in any variety of field because it has high validity and reliability, no? It undergoes a rigorous testing, gaya nung sabi ko kanina sa research, and also it becomes more efficient in clinical practice. Okay? Making it a reliable and valid tool for assessing personality. Of course. Clinical utility. The BPI is commonly used in clinical settings to help professionals better understand their clients' emotional functioning, interpersonal relationships, and overall psychological well-being. So, BPI, to use it more efficiently, we use it in a clinical setting, no? We also we can also use it in non-clinical setting, but with professionals, no, in a clinical setting, we can assess or we can evaluate the individual's personality traits ng mas effective or mas efficient, no? And and also it understand yung emotional functioning, yung interpersonal relationship or yung psychological well-being, no? Kung yung individual ba is may stable emotional functioning, yung interpersonal relationship niya ba is profound or yung strong or something like he or she likes to be a loner, no? And also yung overall psychological well-being, if nasa stable mental condition ba yung isang individual or yung isang tao. Okay? So, easy to administer. So, the BPI is relatively easy to administer and can be completed in a reasonable amount of time, making it a practical tool for use in clinical practice. So, ang BPI is a easy to administer, no? Kasi nga yun lang siya, parang it is a form of survey, no? Yung imagine niyo na lang yung survey na kinakonduct natin sa research. Parang something like ganun yung BPI, but it consists of true or false statements, no? I-check mo lang kung saan ka ba mas agree or saan ka mas appropriate yung personality or yung which describes you more better. Okay? So, interpersonal guidelines. The BPI comes with guidelines for interpreting the results, helping practitioners make sense of the information gathered from the assessment. So, yung result ng BPI, it is not only yung mga basta-basta lang, hindi siya binabasta-basta, okay? It has been guided by professionals, it has been guided by psychologists, it has been guided by professional one to better understand or to gain a more like efficient result or yung much more like appropriate result na dapat or inihingi natin sa isang usually sa isang assessment gaya nito. Okay? So in conclusion, overall, the basic personality inventory is a valuable tool for assessing personality traits and can provide important insights that can inform treatment planning and intervention in clinical practice. So, basic personality inventory is a valuable tool. If you do more research about it, no, it is very convenient, gaya ng sabi ko kanina, and it is very easy to use, easy to administer, and easy to answer, no, by a person, because it does not contain so much complexity dun sa test or dun sa assessment, no, and hindi siya parang burden on the client's part because parang it has to do more on his or her personality and it has easy to be answered, no, true or false, ganun. It is yun nga, very convenient siya and can provide important insights about an individual or about a treatment planning and intervention in clinical practice. So that's all for that's all for our session for today. Thank you so much for listening, and I'm giving the microphone or the stage for my partner, Mr. Mohammed Zaid Basil. Thank you.